So the first project between JWOC and the Armed Forces of Liberia involved the RV-466. And this RV-466 is a project that intends to study or investigate causes of acute febrile illnesses, and with the hope that to be able to identify those detailed causes of fever in West Africa. As you may be aware, we are very limited when it comes to identifying these parasites, connect or associated when the symptoms and the signs that a patient presents with. So this research, RV-466, between the West African group and JWOC team, is intended to sort of identify those different pathogens, be it viral causes or bacterial causes or protozoa or even unknown causes of fever. The idea is to break it down and then see individually what those possible specific parasites are causing the fever to come to, or to allow patients to come to visit the hospital. So we feel that with this categorization of fever causes, we will have more diagnostic panels to differentiate our treatment, or more specifically identify what exactly to treat. And through this process too, we'll be able to set in a surveillance system that we can be able to quickly detect a possible disastrous disease outbreak like we saw in the Ebola outbreak in 2014. So the new Armed Forces of Liberia is just about 11 years old today. The new Armed Forces of Liberia consists of mainly infantry-based, and the medical component of the new Armed Forces came into being about 5 years ago. This medical component is very small, and it faces a lot of challenges with respect to its healthcare delivery services. Being a part of the Ebola outbreak, there was, as you may be aware, a global mobilization of support to respond to the outbreak in West Africa. At the same time also, we saw a huge US military presence in Liberia to help respond to the Ebola outbreak. And this presence of the US military led to a collaboration between Nigeria, Ghana, and Liberia in the formation of a research group in West Africa. And the hope of this research group is to investigate some disease phenomena that may not normally be identified, that may lead to a disaster or outbreak. So it intends to prepare both nations or nations involved to better respond to future outbreak. The Armed Forces of Liberia, being a very young and new part of this network, has so many challenges that are currently being addressed by JWOC. Some of the challenges include human capacity deficiencies, low infrastructure, as well as logistical, as well as technical needs that are lacking. So currently, as we speak, as a result of these collaboration between JWOC and the Armed Forces of Liberia, we see that some of these needs are being addressed currently. We've had some series of trainings to build capacity of the medical staff of the Armed Forces of Liberia. We see also the bringing in of some infrastructural designs, especially in terms of the laboratory expansion for the EBK site. As you may be aware, the EBK clinic is the largest facility of the Armed Forces of Liberia Medical Services, and that's the site for the RV-466 project and future projects with JWOC. So one of the needs for that facility was the lack of adequate laboratory space as well as diagnostics capability. So JWOC is now presently responding in that direction. There is an expansion of the laboratory space. There are equipment that are being bought and placed in there for the studies, and to also enhance our clinical work too, apart from the studies. And most of the pressing needs of the clinic, which has to do with water supply and electricity, are also being addressed by the JWOC team as we speak. So the involvement of JWOC with the Armed Forces of Liberia sort of is going to improve, not only prepare us to do their clinical work or their research work along with Ghana and Nigeria, but also as an entity, it is going to enhance our capability too and our capacity to even better serve our population and possibly populations around us. In addition to this, also we see, specifically for the Armed Forces of Liberia, we see that the component of force health protection is going to be improved for our soldiers. And you know, as you may be aware, whatever good we have for our soldiers, we also attempt to spread out to the surrounding communities. Where the EBK site exists, in the whole district, there is no other Ministry of Health facility there. So that means our Ministry of Health capability coverage in that region is lacking. We feel that with this collaboration, our capability also will be improved for us to respond outside of our barracks in the communities that surround our barracks. So in short, or in closing, there are many good things that we foresee coming out of this collaboration with JWOC, not only to do projects and research studies, but also to enhance our capabilities and also give us the technical support that we need in order to better serve our society and the communities at large.